for a healthier future.
Today, we're tackling a topic that many of us have experienced but don't like to talk about. What clues your stool gives about your health. Sticking, floating, green color, oily texture, in short, every type of stool provides important information about your body. In this video, we'll look at what different stool colors and consistencies mean, with reference to the Bristol stool chart. We'll also give you practical advice on what to do for a healthy bowel movement. What should healthy stools look like? A healthy stool is close to brown in color. This color is caused by the action of bile and bilirubin from the breakdown of red blood cells. Normally, healthy stools should be in the form of sausages or logs, properly formed by the intestines. Defecation should be painless and effortless. The stool can often have a distinct odor due to the bacteria in your intestines, which is normal. Its consistency should be soft and shaped, and it should stay together without disintegrating when it enters water. Healthy bowel movements occur once or twice a day, but for some people, not having one a day is normal. However, if there are no bowel movements for more than 3 days, this may be a sign of constipation. What is constipation? If you have fewer than 3 bowel movements a week and experience difficulty or discomfort during the defecation process, you may be living with constipation. Struggling for a long time or spending more than 15 minutes to defecate suggests that your bowel health is negatively affected. The Bristol stool chart, developed in 1992, is a useful tool for identifying different types of stool. Constipation is expressed as type 1 and type 2. If you are experiencing these symptoms, it is recommended to switch to a diet that includes more whole grains, fruits, and vegetables. If constipation recurs frequently, it is worth consulting a doctor for a specialized opinion. Fiber deficiency. Low fiber intake causes the intestines not to function properly. Other symptoms include a constant feeling of hunger after meals, cravings, low energy levels, and difficulty sleeping. To increase fiber intake, include fruits such as pears, apples, and avocados, vegetables such as broccoli and Brussels sprouts, and legumes such as lentils in your meals. Also, cereals such as oats and chia seeds are excellent sources of fiber. Feces and inflammation. Loose, soft stools with irregular edges may indicate inflammation in the body. This can occur as the body's response to harmful substances such as bacteria, viruses, or toxins. Symptoms of inflammation can include abdominal pain, fatigue, fever, or joint stiffness. If you observe such symptoms, it is important to contact a health professional as they may be a sign of an underlying health problem. Gastrointestinal bleeding. Black stools that look like coffee grounds can be a symptom of gastrointestinal bleeding. This occurs when blood darkens as it moves slowly through the digestive tract. Black stools can also be a symptom of certain digestive disorders, as well as certain foods such as licorice or medications such as iron supplements. Diarrhea. Watery and shapeless stools indicate diarrhea caused by the intestines moving too fast. This can be caused by bacterial infections, food intolerances, or medication side effects. If diarrhea is accompanied by symptoms such as severe nausea, dizziness, or dark urine, you should seek medical attention immediately. Pale or white stool. Pale or white stools may indicate liver or gallbladder problems, usually caused by bile duct blockage. This can be caused by certain medications or problems with bile production. Green stool. Green stools can often be caused by the consumption of green vegetables or food coloring. However, it can also indicate more serious conditions such as digestive problems, infections, or Crohn's disease. Crohn's disease is a chronic inflammatory bowel disease that can affect any part of the digestive system. It usually causes inflammation and ulcers in the intestines, especially the small intestine. Main symptoms: abdominal pain and cramps, diarrhea, fatigue, weight loss, blood in the stool, loss of appetite. Crohn's disease often goes in cycles and symptoms may increase during these cycles. Hemorrhoids. Bright red blood on toilet paper can often be a symptom of hemorrhoids. Although this condition is not life-threatening, it can be uncomfortable. Fat absorption problems. Yellow and oily stools indicate fat absorption problems, usually caused by insufficient bile or enzyme production. This may indicate a condition known as malabsorption, which requires medical evaluation. Why is it important to monitor stool? Your stool can give important clues about your health. Regularly observing the appearance of your stool and keeping track of your fiber intake and hydration levels can improve your overall health. In case of any abnormalities, it is important to contact a health professional immediately. Remember, the most valuable treasure you have is your health. If you like our video, don't forget to like, subscribe and turn on notification for our new videos.